Right now, millions of Americans can't afford the medical services they need. Even if they have insurance, increasing out-of-pocket costs can prevent individuals from receiving essential, sometimes life-saving care, such as clinician visits, diagnostic tests, and prescription drugs. I'm Mark Fendrick, and I've dedicated my career to ensuring that Americans can afford their essential medical services. Most insurance plans set what patients pay on the price of the service. An alternative approach, value-based insurance design, or VBID, developed at the University of Michigan, aligns out-of-pocket costs with the clinical value, not price. Instead of paying more for high-cost services and less for low-cost ones, under VBID, consumers pay little or nothing for highly valuable clinical services. When financial barriers are removed, patients use these high-value services more often, and as a result, stay healthier. VBID is an excellent example of translating academic research into impactful policy. Multiple federal policies implementing VBID have enhanced access to preventive services such as screenings, vaccines, and medications at little or no cost to hundreds of millions of Americans.